Hello friends. Today we are going to discuss about platelet transfusion guidelines. These guidelines are presented by AABB and ICTMG International Clinical Practice Guidelines which are published in 2025. So these guidelines are divided into strong recommendation and conditional recommendation. So first we will see what are the strong recommendations. So, according to these guidelines, if the patient is non-bleeding with hypoproliferative thrombocytopenia, who are actively receiving chemotherapy or undergoing allogenic stem cell transplant, platelet should only be administered when the platelet count is less than 10,000. That means if the patient is receiving chemotherapy and if the patient has suppressed bone marrow and if the patient is non-bleeding, then no need to give prophylactic platelet transfusion. The patient needs platelet transfusion only when the platelet count is less than 10,000. Now, according to recommendation 2, in preterm neonates without major bleeding, platelet transfusion should be administered when the platelet count is less than 25,000. For preterm neonate, the threshold for platelet transfusion is 25,000. Now, if the patient is undergoing lumbar puncture, then at least the platelet should be about 20,000. That means if the platelet count is less than 20,000 and if we are planning lumbar puncture of this patient, then we have to administer platelets. Now, if our patient is dengue positive and if he is having dengue related consumptive thrombocytopenia, in the absence of major bleeding, then panel recommends no platelet transfusion. That means if we know this thrombocytopenia is because of the dengue, then until and unless the patient has any major bleeding, there is no need of platelet transfusion. Now we'll have a look on conditional recommendation. So, in non-bleeding adult patient with hypoproliferative thrombocytopenia who are undergoing autologous stem cell transplant or with aplastic anemia, the panel recommends no prophylactic strategy. That means if the patient is having aplastic anemia or patient is receiving the autologous stem cell transplant, the bone marrow is suppressed, and after that patient had developed thrombocytopenia. Then, and if the patient is non-bleeding, then there is absolutely no need of giving any platelets. According to second conditional recommendation, if the patient is diagnosed with the consumptive thrombocytopenia due to critical illness but not with dengue, now that means patient is not dengue positive but because of some other reason there is consumptive thrombocytopenia, and if the patient presented without major bleeding, then platelet transfusion should be administered only when the platelet counts are less than 10,000. If the patient is undergoing central venous line placement at anatomical site which are amenable to manual compression, platelet should be administered when the platelet count is less than 10,000. Otherwise, there is no need. Now, according to the next recommendation, if our patient is undergoing any interventional radiology procedure, then we need to give platelets if platelet count is less than 20,000 for low risk procedure. And if the patient is undergoing high risk procedure, then we need to transfuse platelet if the platelet counts are less than 50,000. So, in adult patient undergoing major non-neuroaxial surgery, platelet transfusion should be administered when the platelet count is less than 50,000. But in a non-thrombocytopenic patient who are undergoing cardiovascular surgery, in the absence of major hemorrhage, including those undergoing cardiopulmonary bypass, then there is no need of platelet transfusion. That means we have to transfuse platelet only in the presence of major hemorrhage, otherwise there is no need. Now, according to next recommendation, if our patient presents with spontaneous or traumatic non-operative intracranial hemorrhage, and if the platelet count is greater than 1 lakh, including those receiving antiplatelet agent, the panel recommends no need of platelet transfusion. So, the threshold for transfusing platelets for intracranial hemorrhagic patient is less than 1 lakh. Thank you, guys.